Protein is now at Starbucks, and it's never tasted so good. Try our all-new caramel protein lattes with up to 31 grams of protein and options with no added sugar.
Level up, level up, level up, level up, level up.
Level up your drink at Starbucks.
It's a sad reality that doctors who work in pediatric emergency medicine will frequently see children who have been sexually abused. The Rape, Abuse, and Incest National Network reports that 1 in 9 girls and 1 in 20 boys experience sexual abuse. Other estimates are even higher. Some of these children may even be toddlers or infants.
Sexual abuse is overwhelmingly the most common really bad thing that happens to children, physically or socially. And how they come into the ER can look like different things. So sometimes children present to the ER in the context of an acute assault. But then additionally, not surprisingly, children who have experienced a history of childhood sexual abuse disproportionately experience depression, anxiety, post-traumatic stress disorder, physical ailments related to stress. And so we see kids for those reasons as well.
That's Dr. Bronwen Carroll, a pediatric emergency medicine physician at Boston Medical Center and assistant professor of pediatrics at Boston University. She says abusers are most commonly people the child knows, a family friend or relative, a teacher, coach, babysitter, and sadly, sometimes a parent. Carroll says it's rarely the creepy guy in the van asking if you want to see a cute puppy.
Kids are assaulted by people who they know. Child predators succeed because they blend in, they come across as great guys. You know, I always tell parents, the greatest risk to your child may very well be the nicest guy you know. It is the favorite teacher, the trusted coach, the beloved member of the clergy. And the reason why childhood sexual abuse has remained so pervasive is because child predators are really good at what they do. That's the bad news. The good news is child predators are like a football team who keeps winning with a single play. And for whatever reason, it seems that nobody has been watching the tapes or paying attention, but their behavior is entirely predictable. And so if we can teach families and we can teach kids to recognize and defend the play, we can change this problem.
In order for a child predator to succeed in their goal, Carroll says they need 3 things: access, compliance, and secrecy.
The way in which we need to be combating sexual abuse is a 3-prong approach to block predators at each of these stages. So in terms of access to a child whom they perceive as vulnerable, parents and other primary caregivers of children need to be aware of who has private access to their kids. So child predators almost always sexually assault kids either in the child's home or in their own home. And so parents just need to be aware of who has access with their kids. And parents need to make themselves visible because we know that child predators seek out children whom they perceive to have low parental involvement.
Carroll clarifies that being involved doesn't mean you have to turn into a helicopter parent. As a working mom with 4 young kids herself, she knows that's impractical.
I am certainly not attending every lesson, every practice, volunteering at every event at the school, but I make sure I drop in on the babysitter. I introduce myself to the coach. I make sure that I have contact with the teacher so that the adults who my kids are interacting know this child has a parent who's paying attention.
Child predators often take the path of least resistance, which means that if there's a watchful parent, the threat of getting caught becomes greater than they're willing to risk. The second part of the abuser's mission is compliance, getting the kids to trust them and follow orders without pushback. They achieve this through grooming.
The way that this generally goes is child predators don't assault children out of nowhere. There is a grooming process through which predators test kids to see how they're going to react. And so by preparing children so that they know what to look out for and they know what to do if it happens, we can make our children kids who fail predators' tests. So you want your children to know. Adults should not be seeking out kids and treating them differently. If the teacher gives the whole class a prize or brings something special for everyone, that's great. But adults should not be singling kids out for special privileges, special treats, private things that other kids aren't doing. Is that always a problem? No, of course not. It could be completely benign, but it's a warning sign, and your kid should know if that happens, you want to know about it.
Furthermore, adults should not be talking to kids about sex outside of health class or a doctor's office.
And the reason why is because child predators desensitize children to both sexual material and touch. They try to normalize it. So they start with benign touch, right? It just starts with a pat on the back, a back rub, an arm around the shoulder. All of those things can be completely warm, caring, loving, normal. They're not necessarily a problem, but then it progresses from there. So parents should tell their children, if an adult seems to be touching you more than you would expect, even if then they pretend it's an accident, or if an adult is ever showing you sexual material, talking to you about sex, making dirty jokes, those are not normal behaviors, and you should talk to us about it.
The third element child abusers consistently rely on to succeed in harming children is secrecy.
The simplest message that we can give kids is adults never ask children to keep secrets. A secret is different from a surprise. A surprise is making grandma cupcakes for her birthday. With a surprise, the person ultimately finds out, and you anticipate that the person will be happy about it. Secrets are different. With secrets, nobody is ever supposed to find out, and presumably if they did, they would not be happy. So by teaching children, adults do not ask kids to keep secrets. And the beauty of this message is a preschooler can understand it, but it still applies in high school. That is an excellent and simple way to get ahead of predators.
But this knowledge can only work if it's put into practice. Many parents may have a hard time figuring out how to approach this topic with their kids. It can seem scary and inappropriate for young children, but Carroll says not to fear. Parents don't need to get into the nitty-gritty details. Instead, they can frame the conversation in the context of other safety issues that kids are accustomed to hearing. For example,
just like I make you wear a seatbelt, even though I don't expect us to get into a car accident. And just like we have a fire extinguisher in our house, even though I'm not expecting a fire. I want to talk to you about another safety concern, which is adults who have problems in their head and whose brains aren't working properly, so that for reasons that we don't really understand, they want to have inappropriate relationships with children. So these are things that if they ever happen, I want you to tell me about. Maybe it's a sign of a problem, maybe it's not. We'll figure that out together. What I want you to know is I will believe you, I will protect you, I will keep you safe. And then you go through some of the grooming behaviors. If somebody's touching you, if somebody's giving you special privileges, if somebody's telling you to keep secrets, if somebody's showing you sexual material, all those things, we should talk about that.
Carroll acknowledges that unfortunately some kids will fall through the cracks. This may happen when the abuser is a family member, for example, and the parent is in denial and doesn't want to believe their child.
I wish we were operating in a perfect world with perfect circumstances, and of course we're not. My hope is that if we can finally end the cultural shame and secrecy around this whole topic, so this just becomes part of standard childhood injury prevention, just like car seats, just like bike helmets, then kids will hear this messaging from multiple places. They should be hearing it from teachers, through schools, from other relatives, so that hopefully, if a child is being abused by a family member, which happens more frequently than any of us want to think, that child will still get the messaging from other places and know that they can confide in a pediatrician, a teenager, an aunt, a cousin, another relative whom they have a relationship with.
And as we ask children to trust adults, we need to make sure adults are aware of the role they play. Research shows that children rarely lie about being sexually abused, so it's important for adults to take what they're saying seriously. And by making this topic approachable and part of an open discussion, it helps create what Carroll calls conversational scaffolding.
And what conversational scaffolding is it enables people to return to something. It's structure, just like real structure. It's real structure that provides support and provides protection, just like actual scaffolding. And the reason why this is important is because if a family has never had any conversation on any of these topics, and something is happening to a kid that they feel uncomfortable about, it is quite unrealistic to expect that the child out of nowhere is going to find the words and know how and know when to disclose to a parent. However, if you have had a conversation about this in the past, then you've set up scaffolding. And the reason why that's helpful is because then a child can say, hey, Dad, hey, Mom, do you remember how you talked to me once about grown-ups who maybe seem like they're touching you too much? I think that might be happening to me at school.
Experts estimate that there are 42 million adults living in the U.S. today that have experienced childhood sexual abuse. When Carroll is speaking about prevention around the country, she says that invariably someone will approach her and quietly share their story.
Because it is so common, everybody has some version of a story. That is in some ways the bad news, but I also view it as the good news, because I believe that so the estimate is that there are at least 42 million adults who experience childhood sexual abuse living in the United States today, which means that there are at minimum 42 million people who know how real and devastating this is. And I think people are ready for change. I think people are ready to start these conversations and change the culture.
Carroll is currently writing a book about childhood sexual abuse prevention, hoping to help normalize these conversations and end childhood abuse. You can find more information about Dr. Bronwen Carroll and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer this week is Polly Hansen. Our lead producer is Kristen Farah. Our executive producer is Amira Zavari. I'm Elizabeth Westfield.